You know that watch on your wrist? Every single day, it's quietly writing a story about your health. It's logging every step, every heartbeat, every minute you're asleep. But right now, all that data is it's just numbers. So the real question is, can we turn those numbers into a story that actually helps us live healthier lives? And it's kind of wild when you stop and think about it. This is a constant 24/7 stream of deeply personal data. We are literally generating more information about our own bodies than at any other point in human history. It's like we're all sitting on this incredible goldmine of potential insights. But that's the big challenge, right? Having the data is one thing, but understanding the story it's trying to tell you, that's something else entirely. So how do we bridge that gap? Well, some researchers think the answer isn't a single genius, but a team. So this brings us to the core idea from some researchers at Google. What if the answer isn't to build one single, all-knowing AI? What if instead you built a whole specialized team? Think about it. A single AI trying to understand your health has to be a data scientist, a doctor, and a motivational coach, all at the same time. I mean, that's a really tall order for any one system. So this research suggests a totally different approach. Create a team of specialists that actually work together. All right, so let's meet this AI team. Instead of one jack-of-all-trades AI trying to do everything, imagine having these three distinct specialists working together just for you. So let's meet the players. First up, you've got the data whiz. This is your number cruncher, the one that digs through all your data to find patterns and correlations. Then there's the medical expert. This agent acts kind of like a doctor, taking those patterns and explaining what they actually mean for your health. And finally, you have the health coach, who's there to turn all those insights into real, actionable goals and healthy habits. Okay, so you've got the team, but how do they actually work together to answer a real question? Let's take a look at this system in action.
Let's use a super common, real-world question you might ask. It seems simple on the surface, right? But to answer it well, you actually need a bunch of different skills. You need data analysis, you need medical knowledge, and you need a really clear explanation.
You know, the key to making any team work is a good manager. And in this system, that manager is another AI called the orchestrator. Its entire job is to direct traffic. It takes your question, it breaks it down, and then it assigns the right task to the right specialist. And the orchestrator follows this really clear playbook. First, it figures out what you really need to know. Second, it assigns specific little subtasks to each specialist agent. Third, it takes all their individual reports and weaves them together into one clear, coherent answer. And finally, and this is so important, it remembers the interaction, so it actually gets smarter and more personalized over time. And this slide really shows you that division of labor. When you ask about your steps and heart rate, the orchestrator sends the number crunching part to the data whiz. That agent literally writes and runs code to analyze your data. Once it has a result, it passes that number over to the medical expert, who gives you the clinical context. It's the difference between just getting a number and understanding what that number actually means for your heart health. So you might be wondering, does this really work? Well, get this. The data whiz agent was able to generate correct, complex analysis code on its very first try, over 75% of the time. That is a huge leap in performance compared to a generalist AI, and it really shows you the power of having a specialist on the job. Okay, so this all sounds great in theory, but the researchers had to prove it. They put this AI team head-to-head against other AI models to see which one people actually preferred using. And this is the million-dollar question, isn't it? Is all this complexity, the team, the orchestrator, is it really worth it? Or would you be just as happy with a single, powerful AI trying to do everything on its own? Well, the results from everyday users were pretty darn clear. When they were asked who they'd rather talk to about their health, nearly half of them, 49%, preferred the collaborative AI team. That's almost double the preference for a single AI or for other models. So that's what regular users thought. But what about the professionals? The researchers also showed the conversations to a panel of health experts, and their preference, well, it was even more striking. A staggering 80%. Let that sink in for a second. In 4 out of every 5 cases, actual health experts rated the AI team's responses as the highest quality and the most effective. They saw a level of nuance and clinical validity that the other models just couldn't touch.
And this quote from one of those expert reviewers really just sums it all up perfectly. They said the AI team felt client-driven and collaborative, and that it led to a real plan. The single AI, on the other hand, was the opposite. No personalization. It just highlights the massive value of combining data science with real medical and coaching expertise.
So where is all of this headed? Well, this research points toward a really fascinating, but also pretty complex future for personal health.
The grand vision here isn't just a simple question and answer tool. No, it's about creating a true health co-pilot, an AI that learns with you over your entire life, helping you navigate your personal health journey. But, and this is a huge but, before this can ever become a reality, there are some serious safety checks that have to be put in place. The researchers are crystal clear about this. You have to have rock-solid privacy and security. You need to build in clear guardrails so people know when they absolutely need to talk to a human doctor. And of course, any tool like this has to navigate a maze of health regulations to be safe and effective for everyone. Which brings us right back to where we started. Every day, your devices are writing a story about your health. This technology promises to finally translate that story for you, but the real question is one of trust. Would you be willing to hand the pen to an AI copilot to help you write the next chapter? It's a question we're all going to be answering very, very soon.